what are some of the common unhealthy behaviours you might see in family members?
Well, so sometimes what happens is family members, through love and care and affection and trying to do their absolute best by the client, will find themselves unfortunately manipulated by the client into doing things that actually enable the addiction to continue. So they do things like rescuing, basically maybe sort of giving money when actually giving financial support is not the answer. There's all sorts of other ways that you can support, but that would just be one way. But there's all sorts of things that families do that actually that allow the addiction to continue, rather than, and partly that, a large part of that is about boundaries. So one of the things we'll be doing on the family program is helping families to learn about how to put boundaries in place with love and care, because actually the client, the person that's come for help for addiction, it's not like they're to blame. It's not like it's not actually like they have a choice. When they have this chronic progressive medical disease, they're doing something that really is going against their will in some ways. So what we need to do is support them to make healthy choices, and the family is absolutely integral to that in terms of supporting the client, in terms of how they make those healthy choices moving forward.
Earlier you mentioned co-dependency and pro-dependency. What are these terms for those who are unfamiliar?
Well, many years ago, when Alcoholics Anonymous was first founded, or back in the 1930s, as a result of that, treatment centres for the disease of alcoholism started to appear. And what the therapists working at these centres realised was that the family members had a similar process to the alcoholics, in terms of that, for instance, as the alcoholism increased, perhaps the enabling and the rescuing behaviour started to increase as well. So they termed this co-dependency, as if the family member had a dependency on the alcoholic. Okay. Nowadays, actually the word pro-dependence came from a theorist called Rob Weiss in America, and what he's saying is that, well, it's not like the family members are doing anything wrong, and I agree with him 100% wholeheartedly. It's basically done through love, care and affection, and doing what you only know best how to do at that moment in time. So it is pro-dependence. It's the same as the client. The client is self-medicating because that's the only way that they know how to cope with their inner demons or their inner turmoil, their struggles, whatever. So the family are doing the same, but that's why therapy, therapeutic groups, psychoeducation, that's where that comes in, so that we can then support people to make changes. So whilst understanding that no one is to blame, and that no one has actually done anything, they've done the best they possibly could under the circumstances.